Well, I'm giving mindfulness research updates during this conference, and there are three different areas that are of concern. The first is to take a look at the methodologies that are used. And trying to study mindfulness presents some challenges methodologically, because you're looking at something that really is much more of a whole person issue, and it's difficult to get a protocol that can be repetitive and reliable and actually be used in an effective way that captures the dimensions of mindfulness. So that's part of the struggle in trying to get good research. That being said, there's been a significant amount more research that's been done than there was done before, and so we've got nearly 300 studies over the last 4 years in mindfulness, and that helps us to start to achieve a level of consistency in the research that helps us to understand and dive deeper into what's going on. Some of the differences in the way that mindfulness research occurs from other research is, number one, it looks at the values of the individual. So the research ends up being more values-based. It looks at how compassion develops. It looks at how mindfulness can be used to make better connections with people. It can be used to help people to understand what's really important to them better. It also looks at their inner life rather than just at their behavior. And when we start to look at those kinds of approaches methodologically, it really begins to have a different quality. Now, the research that's been done, interestingly enough, is spread in a way that just about divides evenly between research that's done in psychiatric diagnosis, like anxiety, depression, OCD, bipolar disorder, and medical issues, things that are like work with cancer patients, work with chronic pain, work with obesity, so that we see these kinds of approaches being used and being researched in about equal amounts between medical issues that are employing mindfulness as a part of the treatment and psychological issues that are using mindfulness as part of the treatment. What we're seeing, particularly with the psychological disorders, is that the approach is much more long-term and much more less focused on the acute phases of the disorders. So, for example, we've discovered that people seem to respond better to mindfulness techniques when they've had their third bout of depression than when they've had just their first bout of depression. And we look at a little bit of what goes on between those two characteristics, where in that first bout of depression, people are often looking for a cure. But if they've had several bouts of depression, they're really looking at ways to develop skills to be able to live with their lives, recognizing that their moods are going to shift from time to time. The third area that I looked at in my talk was looking at new directions. And there are several new directions that are available. Recent research has looked at how to apply this to school settings and working with children as young as 4 years of age, looking at how that helps people to learn and be better at discovering ways to maintain that knowledge over time. It also has been very helpful for teachers who feel less stress and more joy in their lives. A second area of research that's been done recently is looking at how to employ these techniques with veterans that are suffering from post-traumatic stress disorder and other issues following combat situations. And while this research is newer than the research with school, it's beginning to show some real positive outcomes and will be continuing to be an area of research. An area that hasn't yet been researched but is starting to show lots of more use with mindfulness, and so will likely be a topic of research in the near future, is looking at how to develop a mindful workplace. What effects mindfulness has in the business world. We see hints in case studies right now. For example, the Seattle Seahawks have used mindfulness, and Google is using mindfulness on a regular basis. But there hasn't been a lot of research done in these areas yet, and we're looking for those areas to be areas that will be explored recently. So this gives you a flavor of what we are seeing in mindfulness right now, and gives you a hint of some of the research and where it's going.